Good afternoon, welcome. I'm very excited about this one. We're joined by John Rogers, someone I've known for over 10 years now. So I've got loads of questions that I'm very much interested in finding out myself. So hopefully it'll be interesting for all of you guys as well. Firstly, welcome, John. Thank you for joining me.
Thanks very much, Andy. It's a pleasure. Thank you for asking me. It's good to catch up with you as always.
And first things first, congratulations on your new addition to the family. How's that going?
Yeah, great. Thanks. Yeah, great. We've had another son. We've got three boys now, so we're working towards the five-a-side football team at the minute. So we had a baby boy called Danny 3 weeks ago, and he is thriving and keeping us on our toes. But yeah, all great. Thank you.
Great. I mean, that's a good way to kick things off because I would say you're possibly the man associated with the most number of organisations from a work capacity. So how are you balancing your now 3 children, newborn baby included, with everything else? Or how's Jess doing it, I should say?
Yeah, I think that's the key thing. Is I'm very lucky that I have a fantastic partner who supports me and has supported me throughout my career in sports medicine and has allowed me to get on with doing my job. And it's every year we have annual appraisals in medicine, as you probably know, and the thing that always comes up in my annual appraisal is getting the work-life balance right, because it's something I've always really struggled with. And I think I love my job. I feel very lucky and blessed to do a job that I feel I was born to do, and because I love my job, it's very easy to say yes to things and to get involved because they seem like such exciting opportunities. And but the downside of that is that sometimes I've definitely been guilty of taking on too much, and that has a knock-on effect on the work-life balance. So our 11-year-old son Joshua, whenever he was a young child, when he was about 2 years old, I was working for British Athletics at the time, as well as sort of working at down at Headley Court Military Rehab Hospital. And he that year in 2012 in particular was a really busy year professionally, and a lot of traveling to training camps before the Olympics and stuff. And he used to, whenever there were planes going overhead, he would point up and say, "John's gone." Not even Daddy's gone, but John's gone. So that sort of pulls your heartstrings a bit. But it is really hard, I think. As I'm sure you find, like it's for all of us. Life is busy, and with the demands of modern communication, and working in sport where the expectations can be very high at times. It's it's hard to keep a balance with family life. And as I said, I'm very lucky that I've got a very understanding partner who has been very supportive and helped me progress in my career during that time.
Yeah, no, definitely. That definitely makes sense. And from you also work for a number of different companies, the NHS included, but how do you balance that just from a professional standpoint? You're involved with several private organisations and so on. So how do you manage pulling all of that together?
Yeah, I think it wasn't intentional to work for. A lot of colleagues in sports medicine do a portfolio of different jobs, and because it's a relatively new specialty, I think there's not that many full-time NHS jobs, for example, which would make life a lot simpler. But I enjoy the challenge of working in different environments. So in sport and in the NHS and in private practice and the business development side of that, and in the role I have at MIP as well. It's I work in 4 different locations over 5 days of the week, and it's the other. I've got a fantastic practice manager, Susie, who is I've worked with for the last 8 years, and she's absolutely. I don't know if you've had much interaction with Susie, Andy, but she's the most efficient person I've ever met in my life, and I am a very disorganized person generally. So again, I'm very lucky that I've got her in my life, and she keeps me on the straight and narrow, and she organizes my diary, and I consistently get fantastic feedback from patients, and about what a good job she does, and I feel very lucky to have someone like her supporting me as well.
She's certainly very efficient in booking you in for this, so yeah, I agree with that with my experience as well. So going back to the beginning then, how have you come to be doing the role that you're doing now?
So at university, I was interested in sport. I played Gaelic football up until the age of 21, and then I got involved with athletics at university. And after my houseman's year in Belfast at Belfast City Hospital, I moved to Manchester because there was a really good athletics coach, Norman Poole at Sale Harriers Athletics Club, and that was with the view to pursuing my athletics career. You know, and I worked in a job as a junior house officer where I was working 100 hours a week, and I got a bit disillusioned with medicine at the time, and I thought I was in my mid-20s, you know, I want to focus on athletics. And when I moved to Manchester, I worked as a locum doctor around the northwest of England in a lot of different hospitals, you know, 20 to 30 hours a week, just to make a living really. And during that time I was training twice a day and competing for Sale Harriers as a middle distance runner, which was fantastic, and doing the sport that I loved. And as my athletics career came to an end when I was in my early 30s, I got a call from Neil Black, who was the head of medicine and science at British Athletics at the time, asking me, you know, if I would be interested in working with British Athletics. And I'd done some work experience with their then chief medical officer, Bruce Hamilton, who's a Kiwi who'd been head of sports medicine at Aspetar out in Doha, and was a real sort of influential sort of mentor in my early career, I would say. And for me, having competed as an athlete and seen the difference that having really good quality medical care and could have in terms of management of your injury. I had a lot of injuries and illnesses, and I was fortunate to be put in contact with some really good people who made me think, you know, I'd like to do that. I can see how good that person is at their job. And then in about 2007, I trained as a GP in Manchester, and I'd worked as a GP for a couple of years. And sport and exercise medicine as a specialty was recognised by the GMC, and the first registrar posts became available in London, and I thought, fantastic, I want to do that, and I applied and was lucky to get on that training programme. So I moved to London and started working there initially in public health and in orthopaedic surgery, and at the same time I took on a job with British Athletics, looking after the endurance athletes, so from 800 metres up to marathon, doing a clinic at St Mary's University in Twickenham, and travelling with the endurance athletes to training camps and to championships and competitions. So it was a bit of a transition from being involved in sport as an individual to sort of using that experience to do something that I could involve in my career going forward.
And so, like, you've also from there, like I know you work with the triathlon team, but how did you get involved with the military? How did that one come about?
When I finished my sports medicine training in 2011, there was a job opportunity at Headley Court come up. They were looking for a consultant to work on the lower limb rehabilitation team, and my consultant at the time knew one of the consultants at Headley Court, and he'd sort of put me forward for the post. And It was a at the time I needed a job, and I just qualified, and it was at the other end of the country. We were living in Manchester with a young child, and I was working 1 day a week at British Athletics on a Friday, but I would drive down to Headley Court on a Sunday night and stay in Surrey, and then drive, work 4 days and then drive back up to Loughborough on a Friday morning early, do a clinic at British Athletics, and come back to Manchester on a Friday evening. So it was a pretty exhausting week, but it was professionally the best experience of my life. I learned so much. It was a very special environment, very multidisciplinary, with physiotherapy, exercise rehab instructor. We had podiatry, people who are really experienced in their individual fields, and visiting, professors of peripheral nerve injury. And, so educationally it was, you were seeing a lot of patients, and you were also very supported by the other multidisciplinary colleagues working there, in delivering a very high level of care to the military personnel who came through. So I was very, very lucky. I think it was just at the right time in my career, and definitely I feel helped develop the skills that I needed, and I've used since in my career.
So how do you think something like that, where you're seeing a very different population, how does that help you, say, in the athletic community that you're working with?
Yeah, I think, there's a lot of overlap. And so in that population, in the military population, some of the common pathologies that we would see are hip and groin problems. So femoroacetabular impingement, inguinal disruption, adductor tendinopathy, pubic bone stress injuries, neck of femur stress fractures. So because of the demands and that typically, military recruits who do a sudden increase in their volume and intensity of marching and training get a lot of overuse injuries around their hip and groin. And also, one of the other clinics that I was involved with on a weekly basis was an exercise-induced leg pain clinic, where we'd see patients with chronic exertional compartment syndrome, popliteal artery entrapment syndrome, referred pain from the lumbar spine. And because you're seeing big volumes and it's a tertiary referral centre, where patients are referred from the regional rehabilitation units across the UK and Germany, you get to see some really complex, challenging cases, and you'd be talking through the complexities amongst the multidisciplinary team, and you learn the subtleties of management in those different conditions. And then, I can absolutely think of athletes who I saw in 2012, 2013, 2014, who had hip and groin problems and exercise-related lower leg pain. And I was able to draw on that experience that I'd had at Headley Court, and use the same, go-to national experts to help sort those athletes out. So, there's a lot of overlap, I think, between military medicine and sports medicine. The military personnel are pushing their bodies really hard, and they're getting, common overuse musculoskeletal injuries, in the same way as sports like athletics and triathlon, get a lot of overuse injuries. And specifically, I was working with the lower limb rehabilitation team at Headley Court, and a lot of the injuries that I see currently are lower limb injuries in the endurance athlete population.
Mm. And so you mentioned specifically at Headley Court that the MDT was really strong. Why do you think that was there? Was that just that you got the resources there, you got the time, or what was the particular reason you think that was particularly good?
Yeah, I think it was very deliberate. I think the experienced rehabilitation medicine consultants who worked there had developed the clinics in such a way that they wanted to have the relevant professionals in the room at the same time. And so the typical clinic there would be, and this replicates what happens in the MIAC, the multidisciplinary injury assessment clinics across the regional rehabilitation units across the UK. There's the doc, usually a sports medicine or a rehabilitation medicine doctor, a junior doctor who's documenting and learning, a very experienced musculoskeletal physio, an exercise rehabilitation instructor, so a strength and conditioning type person, and a podiatrist, all in the room at the same time, all sort of, usually it was the sports medicine doc who would take the history, the physio would lead on the objective assessment, and then, you know, we would get our heads together to discuss the next steps in terms of investigation and management. And the process was that the patients would come in for an assessment, and that would take maybe an hour to an hour and a half. And then we would use that assessment to plan investigations and then bring the patient back in for a period of inpatient rehabilitation for 3, or 4 weeks, where they would be absolutely hammered with strength and conditioning, pain management, but, really focused rehab. And, as a result, we saw really good results. And there's not many places, I guess, that have the finance to put that amount in. But it's great to see that these people who are putting their lives on the line, literally for us, in Afghanistan and Iraq and wherever, are being supported with their medical needs in this way. And it was a great learning experience for me to work in that environment. It took a long time to get security clearance, being a Catholic from Northern Ireland, but it eventually came through.
Yeah, no, that does sound like an amazing experience. I've not been to the new centre, but I've heard the facilities are absolutely amazing. But some of my colleagues have been in there, so I'm looking forward to seeing that set up. Do you have any involvement with DMRC now?
Not much. Like, I know I have colleagues who I worked with in the past, and they have kindly offered to support our sports medicine registrars in terms of taking trainees from the Northwest and for a 6-month placement to upskill them on rehabilitation medicine. So we have conversations about that. But no, sadly, I don't have much interaction with them anymore. But just want to see them at conferences and stuff.
Yeah, one of the things that from a personal perspective, I was really impressed and amazed by was that when I was referred, I had a problem, and it comes up, my appointment sheet said Dr. John Rogers. So it's like, all right, okay, that's good. So you're still working in Manchester in the NHS and a really busy clinic, but I guess you don't need to be doing that now. Why do you particularly want to retain doing that position?
I think I've thought a lot about this because I do a lot of different roles, and I've thought a lot in the past about trying to cut back on, so that I'm focusing my energies more in one area than another. But particularly with the NHS role, I believe that the service that we deliver for the population should be accessible to everybody, regardless of their financial background or what their whether they've got private health insurance or whether they can afford to pay for a private MRI scan. I don't want to limit the service that I deliver to people who are just well enough off to afford that. And I also feel that the NHS has touched my life and my family's life in lots of ways. They've supported us and the 3 children that we have fantastically. My partner was in hospital last week with a significant illness, and they were amazing at the maternity unit at Wythenshawe. And they've also supported, the NHS has supported me in my training as a junior doctor and in training towards being a consultant in sport and exercise medicine. And I see patients every week in my NHS clinic where I feel that that we can have a lot of impact, and that can be sometimes quite pivotal at that point in that person's life. And I feel that it's important that that's accessible to the wider population, and it's not just for the elite athletes or the people who are well enough off to afford private healthcare.
Yeah, no, it's certainly great. And how do you feel that difference between that? Are there any key things that you see as being different between the NHS work and the private work? Because a lot of the time you are seeing someone like you in both of them. But like, how do you see the key differences between them?
I think, like, sadly, in some respects, there is a two-tier service at the minute. So in the private sector, we can get MRI scans done on the same day. We can get a top-level orthopedic opinion from the top orthopedic surgeon in the country within 1 week or 2 weeks for that particular problem, for example. Or we can get a top-level sports cardiology opinion on a specific athlete heart issue. So it's the speed of access, I think, in private healthcare is very different to the NHS. So our turnaround times for appointments at the minute, we've got a massive backlog following the lockdown period. So we're seeing patients, maybe within new referrals within maybe 6 weeks at the minute. And then it's 4 weeks for an MRI scan, and then another probably 4 weeks for a review appointment. So it's much slower in that respect. Although cases are still prioritized depending on clinical urgency. So cancer cases are still prioritized, and so there's that difference. I guess in the NHS clinic as well, this is a generalization, but we see probably more psychosocial issues in the patients that I see in the NHS, although we do see very similar physical presentations in either sort of the private sector or in the NHS.
Yeah, no, it's definitely good that you're doing anyway. So you mentioned some of the roles that you've really enjoyed, and have you had any ones that you found particularly challenging? Maybe in a good way, but also maybe in a way that's like, why the hell did I sign up for this one?
Yeah. I think the British triathlon job was particularly challenging, and I loved the job in lots of respects. We had a great team of athletes, and there are a great team of athletes there, both the Olympic and Paralympic, and the medical team and coaching staff were lovely people to work with, and it was I really enjoyed traveling to triathlon competitions and covering the events. The challenging part was I found it a very stressful job in that the time commitment was 1 day a week, and to cover things off from a clinical governance point of view probably required at least 2 or 3 days a week, and it was very hard to try and squeeze that in. And I felt like it was managing a lot of risk where athletes were training or competing in different parts of the world, sometimes where the emergency medical care at the events was substandard from what we would accept in the UK, and as a result, the risk management, I only felt like we had only so much control over that, and it felt like the International Federation in triathlon had some work to do to get up to the standards that maybe other international federations were at, and that caused me, a lot of anxiety and sleepless nights, and ultimately I left the job because of that. After working there for 3 years, which was a difficult decision to make, but definitely, in retrospect, the right decision. In working in athletics, it was a fantastic opportunity, and working in a sport that I'd competed in and loved, and working with athletes who were competing in, making finals in Olympic Games and stuff, was amazing to be, very privileged to be involved in that journey with them. But at the same time, the challenges of 130 athletes having your mobile number and having your email address, and taking calls, 10 o'clock at night, whenever you've got a young family, it's that was challenging. But Andy, I feel so lucky. I do a job that I absolutely love, and I don't have to work nights. I don't have to work. Well, I work some weekends, but not that many. I have a lot of medical colleagues who do work in A&E, saving lives, and are working cancer medicine and things like that. It's proper medicine. I do a job where hopefully, at times it influences and helps people's quality of life, and helps them pursue, their goals and ambitions. But it's a bit of a busman's holiday, really, because I'm going into work every day with a smile on my face, because it's very varied, and the different roles that I do, it's always stimulating and challenging, and stressful at times, but in a good way. Generally, by and large, it's good stress. It's stuff that, if it's not stressful, then I think I would get bored.
Yeah, well, as we were saying before, I did try and dig up some dirt on you from some of our mutual acquaintances, but sadly, I didn't get that much anyway. Well, not for camera work anyway. Going back to what you were saying there, how important do you think it is, or how much has it helped you, being a former athlete or an athlete, working with similar athletes?
I think it's been incredibly helpful, because I think part of the tools of your trade in sports medicine terms are you learn from the coaches. Like when I think of the coaches and the mentors, even from PE teachers at school, that's learning from being crucial in my career. When I sit down with an athlete who's suffering with fatigue, and I'm taking a history that includes their training history, and you're looking for load variation, and a lot of the triathletes or cycling or running based athletes who I see, if I hadn't competed in sport and I didn't have that insight, it would be very, very difficult to understand, to empathize with them, but also to understand the science behind the coaching and the strength and conditioning. I think most of what I learned for sports medicine came from competing, and seeking out, sports nutrition, strength and conditioning, psychology, input personally for me first and foremost. And when you're really engaged in that way, and you're hungry for the knowledge because you want to perform as well as you can, that's been really helpful to draw on that experience with athletes who I've been working with.
Yeah, definitely. And have you ever been tempted to look at other team sports like football or rugby? I don't know if you can share any offers you've had or anything like that.
Yeah, like I worked with Chelsea Football Club with the academy when I was a registrar, and I did get asked about post with a Premiership academy team about 4 years ago, and it was. And I was really tempted at the time, because it's a team that I support, and part of me regrets not taking that post at the time. But it was, I know from friends and colleagues who work in football medicine, the impression I get is that it's all consuming. It's 365 days a year. It's and it's very full on. And I like at the moment having a bit more balance in my life, that I can spend time with my family at the weekend and do a bit of sport myself. And but I definitely I do want to do more work in elite sport in the future. At the moment, I think it's needs must, and it's sort of doing what I the outpatient kind of stuff, which I really enjoy. But maybe when the kids are a bit older, I'll get back into doing some more elite sports stuff.
Yeah, no, it's definitely, I can imagine it'd be all consuming doing that. Just going back to the beginning again, you didn't actually say why medicine. How did you get involved in that initially?
I remember sitting down with my PE teacher, who was a big influence in my life, a guy called Peter McGinnity, who was GAA All-Star. He was like one of the top Gaelic footballers in Ireland, and happened to be our PE teacher. And my dad was a PE teacher, and I sat down with both of them at a parent teachers meeting when I was about 16, and I was debating on training to be a PE teacher or doing medicine, and I think I was doing science subjects for A level, and my older sister was studying medicine in Belfast at the time, and I think I probably didn't have enough insight at the time. They maybe sort of felt that medicine was the right decision for me, and probably looking back on it now steered me in that direction. And I'm very glad they did. Like I love PE, like I loved that at school, but I think I also was very into science at school, and it just seemed to fit with probably my personality type, and but I was probably in summary I was influenced by my older sister, who's been a mentor throughout my life really. She's a GP in Belfast, and also my dad and my PE teacher.
Right, and then when you were talking about when you were doing, did you come to running purely when you were at university? So were you quite a late starter to running?
No, I got into it at school. So I did. I competed in like sort of athletics in the school, Ulster schools and stuff like that, and cross country, and I did. But Gaelic football was probably my first sport. And then when I was sort of 20, 21, I got more into athletics because I guess it sort of worked out that I was maybe better at running than I was at football. So, and running has been like, I met Jess through running, and I know at a particularly difficult point in my life when I was a junior doctor in Belfast, working 100 hours a week, and I suffered with probably depression looking back on it. Running was the one thing that gave me some positivity and confidence in my life at that point, and it was and it has given me a lot of enjoyment over the years, and I've made a lot of great friends and done a lot of traveling and stuff, so it's had a massive impact on my life, and I'm really glad that I've been able to do that as a sport.
Yeah, well, I still know that you turn up and win the Didsbury Park run every now and again. So unless Tom Lancashire's running, I'm sure he'll want me to say that.
Yeah.
And so are there any sort of things that you would say that would be important for someone wanting to get into this, whether it's as a physician or a physio, or what would your advice be on that?
Like, I think with anything in life, and it's not an easy thing to find out what your calling is or what your passion is, but if it is something that you want to do, go after it and follow it with all your strength and dedication, because it's a fantastic career. There's a lot of different opportunities out there within sports medicine, whether you're a physiotherapist, a sports rehabilitation professional, or a sports medicine doctor. There's opportunities in military medicine, in the NHS, in elite sport, and in recreational sport, and the exercise medicine component as well, which hopefully, as time goes on, that will be a much bigger part of the wider medical community for patients with cancer and cardiovascular disease and mental health problems. So it's a fantastic, fun specialty, and I think if you want to do it, seek out the opportunities. There's professional organizations like BASM or like BASRAT, in terms of education, but there's also I started off being volunteering as a club doctor at Seal Harriers for 7 years, and that was a fantastic experience, seeing athletes and learning my trade, so to speak. And I know there's loads of football clubs and rugby clubs across the region who are crying out to have help from physiotherapists and doctors. Volunteer and get stuck in, and say yes when the opportunities arise, because it's a fantastic specialty, and I can see that it's growing and developing, which is great to see.
Definitely. We were talking before as well about personality types. Like at Physiquip, the whole team have just done it. So I'm going through everyone's personality types, and it's very interesting to see. Apparently, I'm terrible at relationship building and execution, which is a dagger to my heart. But anyway, that's what the test says. But I know you were talking about that. Can you share any snippets from your personality test you did?
Yeah, sure. It was really interesting. We did it was called Insights just before the 2012 Olympics. Sarah Cecil, who's English Institute of Sports psychologist, did this process with us to look at how we interacted as a team and with the athletes. And depending on how it was a 30-minute questionnaire from memory, and then you were graded in different colors, whether you were mostly red, which is very strong on leadership and on very sort of feisty type personality, confrontational, yellow, which was very creative, green, which is sort of care and compassion, tree hugger type, and then blue, which was quite analytical. And mine came back sort of 50-50, green and blue, so caring and analytical. So I think it's probably quite accurate. I feel, I hope anyway. And I know, some of the colleagues who I've worked with in the past, who I hugely respect, and some of my mentors, have very strong leadership traits, and are very confrontational when they need to be. It was a really good exercise in learning how to maybe try to get the most out of yourself and other people, and how to interact with other people.
Yeah, no, I definitely think so. I definitely agree with that analysis of you as well. So that's good. So, John, thank you very much for joining us. I'm definitely going to be tapping up Susie to do a webinar with us in the near future. So I would definitely, we'll factor in some time for that. But other than that, really enjoyed talking to you and hearing a bit more about you. So thank you for joining us, and I will let you get back to your nappy changing or whatever else you need to be doing.
Thanks, Andy. It's been great speaking to you too, and great to have time with you again.
Good man. All the best.
Cheers. Bye-bye.